By a show of hands, how many people know someone in our age group who is currently pregnant or has had a baby? Okay, so do any of you know of a baby under the age of 1 who has died? So, many of us have heard of infants dying due to various circumstances such as injuries, being born underweight, or birth defects. But do we know if these babies are dying due to these circumstances or because of their race? There is a disparity in infant mortality rates, especially between the Black and white communities. However, measures have been taken in order to reduce these numbers. Infant mortality can be caused by numerous factors, and these factors are highly present in the Black community. Yet the involvement of the Department of Health and Human Services, the HHS, has helped to reduce these numbers. By the previous show of hands, many of us know people of our age who are pregnant or having babies. Most of us also identify with a minority background that is affected by infant mortality. For the most part, many of us are knowledgeable of the race of Black and men and women dying, but not knowledgeable of the race of Black babies dying, those who are turning into these future Black men and women. I have lost my 5-month-old niece to infant mortality, and since then, I have been using the information that I will share with you today as a reason how to understand why her life was affected and the life of my family and friends affected by infant mortality. For those of you who are not familiar with the term, you may also be unfamiliar with its causes. The CDC, the Centers for Disease Control, defines infant mortality as the death of a baby before their first birthday. The causes for infant mortality are not certain, but there are multiple speculated reasons for it. According to the CDC, most infants die due to being born with a serious birth defect or being born prematurely or underweight. In addition to, the CDC also claims prematurity and low birth weight are the #1 causes of infant mortality. 4 years ago, 57% of infant deaths were because of these causes. But these causes aren't race specific, they just happen to occur in Black communities, according to the CDC as well. Behavioral, social, political, and medical factors influence the racial disparities in infant mortality. Infants' survival long-term health is also influenced by the mother's age, health status, and behavior during and after the pregnancy. Almost 81% of Black mothers received no prenatal care during their first 3 months of pregnancy in 2011. Those who are born to mothers who do not receive prenatal care are 3 times more likely to be born underweight and 5 times as likely to die, rather than those who do receive prenatal care, as stated by the HHS. The University of Rochester Medical Center claims teen mothers and those exposed to illicit drugs, alcohol, and cigarettes are more likely to have a baby born under the normal birth weight. Also, mothers of lower socioeconomic status are also more likely to have poor pregnancy nutrition, inadequate prenatal care, and pregnancy complications, all factors contributing to low birth weight, the #1 leading cause of infant mortality. Because infant mortality rates are products of social, political, and behavioral factors, many initiatives have been put out to reduce the total number of infant deaths. The HHS has started initiatives to promote healthy choices to reduce mortality rates, encourage research to further determine the exact causes of infant mortality. The HHS supports Medicaid, who provides access to prenatal care for eligible mothers, and also health coverage for millions of infants born to low-income families. The Healthy Start program, also funded by the HHS, works to expand the availability and accessibility of prenatal care in more than 100 cities affected by these infant mortality rates. The HHS also supports a wide range of medical research to prevent and treat birth defects, premature births, and other life-threatening conditions. Organizations, in addition to the HHS, also promote and provide funds to further the research to find out the real cause of infant mortality. Infant mortality is the result of numerous circumstances thus far, related to mostly the prenatal care of a baby, not the race of the baby. However, many initiatives and research are being implemented to reduce these numbers of babies dying. There is a disparity in infant mortality, and especially between the Black and white communities. Yet, measures have been taken in order to reduce these numbers, especially in the Black communities. So although many of us may not be considering to be parents, at least for a while, the information shared with you today regarding the disparities of infant mortality and also the cause of infant mortality may be helpful to you in the future.